Friday morning, the state, which ordered Hacienda Healthcare to hire a third-party manager, made it clear it was not on board with the facility shutting down its ICF unit. Parents of patients in the ICF were worried too.
That meant the department where my son is, yes, that's the one that would be affected by this.
This morning, the state's healthcare cost containment system responded to Hacienda's closure plan, giving them a 4 p.m. deadline to answer specific questions about it. Hacienda responded just in time, saying they were willing to voluntarily enter into an agreement with the Department of Health Services when it comes to licensing authority. This basically gives the state more power to regulate the facility that only had federal regulations.
They are definitely headed in the right direction. They cannot close Hacienda down. There are 4 places like Hacienda in the whole country.
In its letter to the state, Hacienda also listed changes it's made since the rape happened. Additional armed guards, 30 internal cameras, an electronic key card system, and more. Angela Gomez, who wasn't having much luck finding another facility for her son, applauds the regulation agreement.
Well, I feel that they need to be. And I don't feel that the facility, the area where my son's at, should close down because they're the ones that need the most care.
Now the state is working on its own new 90-day plan, which includes hiring a third party to oversee operations.
I'm not one for a lot of state control, but if that's what it takes to keep the place open and going, and maybe they'll see that Hacienda is going in the right direction.
There are other new security measures in place, too. You can see everything Hacienda started to do differently. Their letter to the state is up in its entirety at azfamily.com. Live in studio tonight, Spencer Blake for Arizona's Family.